as with many things in life, the strongest learning is experiential. And actually, that happens with everything that we do in our lives. We start with intellectual, we move to relational, which is observing, and then finally experiential, the most powerful. Any of you that's a parent will know this better than probably anybody, because no matter how many baby books you read, it compares to nothing to actually holding your own child in your own hands, right? That's where the real learning, the real understanding actually comes. And actually, I've delivered a similar presentation once before, and this was a slide that I used where it turns out that Takeda is already one of my best case examples on this, as a company that really is doing this. And I have to say that I am very pleased that the In the Shoes campaign not only has involved a large number of employees from the company, but it is also now going out, as I understand, to your customers as well. Very similar to what Grunenthal do. So their initiative was called Change Pain. The idea of it was to try and get doctors to understand what pain really is, what it really means. But you know, they weren't taken seriously. When a patient comes in and says, I've got an 8 out of 10, what does that mean? So what they actually did was they constructed a box. I haven't tried this myself, it sounds horrific. A box where you put your arm in and you actually experience varying levels of pain. Sounds kind of like a Halloween thing, doesn't it? But they found that incredibly effective in driving up the understanding that their customers had. Because what's really important is you understand that your physicians, your customers, do not have an experiential understanding of the disease either, do they? They are still on number 2, the relational, the observing. They've just done lots and lots and lots of observing. But in most cases, they've never actually experienced the disease themselves. So you can provide some very valuable insights there if you're willing to go through this same experiential process yourself. The last one there, Leo becoming Sarah, was designed, that's actually a very good initiative because it pervades absolutely every single part of the organization. And one of the most interesting times was when the company, including the CEO, had to wear a lot of makeup to simulate the effects of having psoriasis, which is where they operate, and walk around for a couple of days experiencing what it's really like to be a psoriasis patient and the social rejection that you get as a result of it. So I think it's you guys are definitely walking in the right way about that.